Welcome to this episode of the Catalyst podcast, One Doctors on a Rheumission. In this episode, you're going to meet Dr. Yu, who is an integrative rheumatologist that incorporates complementary medicine with traditional rheumatology. He's triple board certified in rheumatology, internal medicine, and lifestyle medicine. He obtained his MD from Chicago Medical School and holds a master's in healthcare administration and biomedical sciences. He completed his internal medicine residency and rheumatology fellowship at Loma Linda University in Southern California, and he's a graduate of the Andrew Weil Integrative Medicine Fellowship at the University of Arizona. In addition, he is certified in functional medicine through the Institute of Functional Medicine. I loved this interview because he has a very unique perspective on autoimmune disease. You're going to learn that he had arthritis when he was 17. Yeah, he was diagnosed with gout. And this continued as a painful condition that eventually changed into spondyloarthritis as well, all the way through residency. And it was able to give him this perspective. He turned this into a beautiful Rheumission who is changing the world of how we view autoimmune disease. So, in this episode, you're going to learn about his original story and how he has started this landscape of treatment to offer his patients. In his paradigm, he brings in food, nutrition. You're going to learn about stress. You're going to learn about gut health. You're going to learn how he breaks this down for his patients and the unique workflow that he has set up. So, whether you're a patient or a practitioner, this interview is one you want to listen to. He has such a great way to spark this curiosity of how can we take care of autoimmune patients and their conditions in a healthier, more creative way. Hi, I'm Dr. Laura Salyer, a former burned out physician turned mentor and coach for overworked healthcare professionals looking to catalyze their inner spark and spirit. I believe in a world where doctors will flourish inside and outside the exam room by redefining medicine as a self expression of the healing arts. So, if you're ready to step into your highest creative power and transform your practice, this channel is for you. Hit subscribe, and together we'll color outside the lines to paint your work life masterpiece. Oh my goodness, Dr. Micah Yu, I am so excited to have you on the Catalyst podcast. I've been admiring your work for years, and I know we run in the same circles in functional medicine. And, both of us looking to create a new version of healthcare, something that we want to transform patient lives. And my friend, I love that you're really encompassing this integrative and rheumatologic area of functional medicine and integrative medicine in such a unique way. So, first of all, Dr. Micah, thank you for coming on the show.
Oh, thank you so much for having me, Dr. Laura Thaler. It's a pleasure being on your podcast.
Oh my goodness. And so let's start from like your story. Let's start from your catalyst moment. And then we're going to go and I want our audience is a mix of patients and practitioners looking to kind of design their own unique work-life balance on their own terms. And you have a mission, you have a desire and a passion. So if you don't mind sharing your story with us.
Yeah, so my story started way long ago, back in high school when I first got diagnosed with gout after going on a very high, very, very high protein diet at Atkins diet. I know some people don't have any issues with going on a high protein diet, but I did. So that I got gout in high school. Luckily I lost weight. At the same time, I don't think it was worth it. And then over time, I eventually got diagnosed with another arthritis called spondyloarthritis.
Oh my
I had
goodness.
the joint pains that were unexplained. Multiple rheumatologists saw me, but couldn't really explain what I had. And I suffered through this during college, after college, and even during medical school. And I wasn't diagnosed until residency when they actually did an aspiration of my ankle. So they took a needle and drew fluid out of my joint, and they also did an ultrasound of my joints as well. And they found that I had spondyloarthritis after many, many years of um, having so much pain. So that led me on to a journey of figuring out how do I fix myself because I was offered medications that other rheumatologists patients would be offered, like methotrexate, Plaquenil. But I wasn't ready to go on the medications yet. Doctors are the worst patients, so I didn't
Yes, we
listen to
are.
my attendings recommendations. So I found food as medicine. Luckily, I went on a plant-based diet for a couple months. And within 2 months, I was pain free. Within 3 months, my C-reactive protein, which is an inflammation marker, went negative after many years of being positive. And I went on a plant-based diet for a couple of years. So it was very healing to know that food as medicine was so powerful, even though we didn't get taught any of that in medical school.
Yes, I second that. I think for me anyway, nutrition, and even though being a DO, we're very holistic. We learn manipulation, we learn a lot of the mind body connection, but nutrition is still very much a short course of just a stepping stone. You barely learn much, at least when I was in medical school. Hopefully it's changing. But what would you say is the biggest misconception that you might see or hear from patients that think, why would I want to change what I eat if I have arthritis?
Yeah, the biggest misconception is that food doesn't work. I need to take meds, or there's nothing else out there. Um, my doctor knows everything because he did a residency and fellowship, and that's simply not true. There's a lot of ways to heal the body. I mean, diet is one component, as you know, Laura. There's so many other components to this that we learn in integrative and functional medicine, and unfortunately, it's not being taught in regular education.
Yeah, I agree. I agree. And when you have a patient that's motivated like yourself, I'm sure after years it sounds like of having, pain and that's suffering and to then, have that little bit of a grit that none of us as physicians tend to want to even be on medication. A lot of us we are the worst patients, but that combined to give you the kind of the perfect storm where you were, looking for other avenues. So, how did you stumble upon the plant-based method and like walk me through how that sort of opened your eyes and where you are today?
Yeah, so I stumbled upon that by working at Loma Linda. My wife is also a physician as well. She's family medicine trained. And at that time during residency, she was going through a lifestyle medicine training program too. So she told me about it. She started on a plant-based diet first. I thought it was really disgusting in the beginning. I was not, I was used to eating more of a like a healthier standard American diet.
Right.
So she cooked plant-based meal for Thanksgiving. I wasn't used to it just yet. Then I went to Guam for a medical rotation there. It was through Loma Linda, so it was a Seventh-day Adventist rotation. So a lot of people there were eating like a plant-based diet, vegan diet. So I got exposed to that more. And then I read Dr. Michael Greger's not Forks Over Knives,
How
How
not
Not to
to
Die.
die?
Yeah, that
Yeah.
book. So that gave me some inspiration, and then watched Forks Over Knives, the documentary, which was very popular many years ago. And then figured, let's just give this a shot and see where this goes. And luckily, it did work out. So from there, I got inspiration that maybe I wasn't taught everything I need to know in medicine.
That's a hard
Because
pill to swallow, don't you agree?
yeah, because I know
Literally.
because I had my attendings not even believing me.
Right.
People that was like, "You still need to take meds." Like, I don't believe
Yes.
you.
Yes, because
And
I think don't they did they have the same feeling or I guess teachings they did for me is once you're on the autoimmune track, it's just like inevitable. It's like a train that keeps going and well, you're gonna get another disease and another one. So you might as well start your medicines now. Oh,
right. I mean, some of my attendings believe me that they were pretty surprised. Some were like stumped because it's not the normal way of practicing.
mhm.
So yeah, that got me curious of what else I can do. So that's why I went on to get my lifestyle medicine certification. I went to complete my integrative medicine fellowship at University of Arizona and with Andrew Weil. Got board certified there, and I did my functional medicine certification too. So I was like, what else is out there? And I'm still going to lectures, still learning.
Oh, sure.
There's so much to learn. So I'm still attending a lot of courses. But yeah, I mean, nowadays I'm not 100% vegan. I was doing that for 3+ years, but I learned over time that plant-based diet isn't the only diet that will heal patients. At first, I was like, oh my god, a vegan whole food plant-based diet was the only way to heal
Right.
patients because that's what healed me. That's the answer.
Right.
And you see all these testimonies online, but I'm open my own practice and I saw patients that went paleo, sometimes that got better. I've heard patients that went keto that got better. Right now, most of the evidence is on the Mediterranean diet. Of course, that's a body of evidence for autoimmunity. I mean, the American College of Rheumatology recently put out guidelines for integrative RA 2 years ago, and they put Mediterranean diet as the recommended diet. But I know that Mediterranean diet is good. However, it might not fix everyone. So I've seen patients heal with many different diets, but most of the evidence is, I would say, a lot of fiber and phytonutrients, which is along with the Mediterranean diet. But I
Yeah.
mean, everyone's gut microbiome is different. The genetics are different. So there's no one size fits all.
Yes, beautifully said, beautifully said. And that is absolutely why, we as practitioners need to help educate our patients that, it's trendy to follow the what your neighbor might do to heal their diseases, but no two people are alike. And the middle of the road, we when we find some healing somewhere, we tend to love to be extreme and, kind of exuberant about this healing process, like you were with the vegan plant-based diet. Oh my gosh, it must be for everybody. But yeah, the more we know, the more we know we don't know anything. I mean, I think functional
Exactly.
medicine is an endless rabbit hole of this amazing learning that is just so awe-inspiring. And you just take it one step at a time with each patient, you treat them differently, right? And so,
Right.
food is one part, nutrition, how we fuel our body. What would you say is the second most commonly missed part of helping an autoimmune disease kind of go into remission or be quiescent?
Yeah, the mind body medicine piece comes in number two. I mean, along with sleep, but the mind body medicine piece is so important. Oftentimes, we don't ask about trauma or what our patient's upbringing was. Did they get abused emotionally or physically? How's their stress levels? What's it coming from? Are they going through a divorce? Are they grieving loss of a family member or even a pet? Did they experience war or death at a very young age? So these things are very important. There is so much of our mind controls the pain. We know that patients with anxiety and depression, there's higher incidence of that in autoimmune diseases, and there's inflammation of the brain that is connected to the systemic inflammation of autoimmunity. So there's these things that we overlook. We don't have time to talk about at a regular doctor's visit. What, you get like 10, 15 minutes, you're talking about meds, and then you talk about symptoms. Who has time to talk about the mind body medicine piece? So, and who's even time to think about it? And even learn about it in medicine. So unless you're doing psychiatry.
Do your patients have this glassy eyed look as you're trying to explain mast cell activation syndrome? Or perhaps you're running late again because you were trying to describe the physiologic impact that a dysregulated limbic system has. Listen, I get it. My years as a family medicine physician taught me that the sooner I could help my patient understand what's going on in their body, the quicker they felt better. And the same holds true in functional medicine. When I started my practice in 2016, I quickly learned that that's a big ask. Functional medicine is pretty complicated, so I went to work. I started designing infographics specifically for functional medicine, so it makes it easier to explain and help your patients understand what's going on. Fast forward, I have over 70 infographics in 4 themed bundles. And you get lifetime access as the editor. You get each Canva link so you can upload your own logo, you can change the translation, you can change the colors, and you get lifetime access, including any future infographics that are added. This is perfect for patient education handouts, for your waiting room posters, for social media, and even backdrops for lectures you can give to your community. So it's time to color outside the lines and catalyze deeper understanding in your practice. Head to drlarasalyer.com/shop and check out the infographics. Keep coloring outside the lines. So, as food is really important for overall disease and lowering inflammation, and we've talked about how stress is super important and it's kind of hard to bridge it, but once patients start to understand how our body's connected with everything, there's a lot of moving pieces. There's a lot of things that we need to help patients do and understand. So, talk to me more about how you help patients understand all of these elements that can control or aggravate their disease.
Right. Yeah, that's a great question. It's very difficult to do it in a regular practice. So since coming out of fellowship, I went straight to private practice. I developed a private practice called Dr. Lifestyle with my wife, who's a physician, and we do functional and integrated medicine with rheumatology, but it's just us that we do with the patients. So we have also been medical directors as well of a virtual rheumatology clinic called Remission, and that's where it's team based. It takes insurance, and what's great about it is that there's multiple team members. So they see a rheumatologist like myself when the patients come into remission, and then they can see a lifestyle medicine physician or a PA or an MP, and then we have dietitians and also psychologists on board as well. So a team-based integrative approach that's virtual only for rheumatology patients. So when you ask me, how do I approach the trauma, the mental health aspect of the rheumatology patient, I defer to the rest of my team because I can't do it alone as a rheumatologist. It's very difficult.
Yes.
So as a rheumatologist at Remission, I deal with the supplements, I deal with the diagnosis, the symptoms, and also the medications. But what about the other aspects that
Mhm.
as a rheumatologist I'm not trained in and don't have time for? Well, that's where the lifestyle medicine team comes in. So the lifestyle medicine clinician will go over trauma, stress, diet, all the basic foundational pieces that are so crucial to healing an autoimmune patient. And then the patient will then go to a psychologist or a dietitian if they need that extra step or they're more complicated. So we have all the pieces in place to help these patients heal and get better.
Oh, that's incredible. If you don't mind, I'd like to have you walk me through what a typical patient experience might look like in that workflow in your Remission clinic. And I love that it's virtual. I love that you're encompassing all these team members so they can stay in their zone of genius and offer their specific support to really help that patient progress. So walk me through just an example of what someone might expect when they come in and they start. Where do they start?
Right. So if a patient comes, finds us online or whatever, but let's say they don't have a diagnosis, that's fine. They can still see us and we can actually diagnose them virtually. It's possible. A lot of clinicians and other providers outside of rheumatology or virtual rheumatology think that it's not possible, but it is possible, especially ever since the pandemic happened. There's more people doing virtual rheumatology. So you can have a diagnosis like RA or just have joint pain, come see us. The first clinician you'll see is the rheumatologist, which is me at this time. Um, and we are integrative. So you'll see me, I'll ask you about your symptoms, diagnoses, your what meds you've been on, what your goals are. And I'll also go over your lifestyle medicine questions such as what diet you're eating. Do you have stress? Do you have trauma? Are you sleeping? Are you exercising? And what other things are you doing in your own free time that can help you with your pain? How are you coping with your pain other than medications? I'll also go over the supplements, whether you're seeing a functional medicine provider or you're doing it on your own. I will talk to the patient and ask them what supplements and what meds are on and combine everything together and tell them the possibilities of healing with or without medications. Of course, there are patients that need medications because they're so severe or they're flaring all the time despite doing all these other natural therapies. So the patient will see me first. If I feel like the patient needs lifestyle medicine more work or they're not optimized in that aspect, I'll send it over to the lifestyle medicine clinician. So that's step number two. So the lifestyle medicine clinician will go into deeper detail on sleep, diet, especially the anti-inflammatory diet, how that can be optimized, mind body medicine, how to improve stress levels, how to react better to pain as well, and work on the exercise component. I mean, and also possibly recommend other supplements as needed. And so they're an extension of the rheumatology appointment. Things that I want to do, but I don't have time for.
Nice.
And these lifestyle medicine clinicians are lifestyle medicine certified also. So they have a primary care background plus lifestyle medicine certification. And if the patients know the control, they're easier to take care of, then maybe they'll stay with lifestyle medicine, bounce back between rheumatology and lifestyle
Mhm.
medicine. However, if the patient is more complex, they have a lot of food sensitivities, they need a custom diet, we will then send the patient onto the dietitian. So they may be seeing three of us. As a patient has a lot of mental health conditions, they have a lot severe anxiety, depression that could be affecting their pain. We will send to a psychologist, or they need to change the way they approach their chronic pain. We will also send to a psychologist, and there's different therapeutic modalities that can be used, whether that's CBT, cognitive behavioral therapy, ACT as well. There's multiple things that we can do to help retrain the brain to better understand how to cope with that pain better. So potentially the patient could be seeing all four providers, which is great because in a typical academic center or even the community setting, you don't get this type of care. You see the rheumatologist,
Mhm.
that's it. Or this rheumatologist says, oh, you can see a dietitian. Well, what do I see? Oh, I don't know which dietitian you see. Or go find your own dietitian, go find a psychologist. No one's talking to
Mhm.
each other. The dietitian could be saying something completely contradictory to an anti-inflammatory diet. Because typical RDs and dietitians, they don't learn about
Mhm.
autoimmune specifically, this type of holistic care. Rheumatologists
Right.
don't either. And
Right.
we have to learn it on our own through more education. Um, that's the beauty of Remission is that not only is it team based, but we're talking to each other behind the scenes. We are also taking insurance in this company. And right now we're in California and Pennsylvania. We're looking to expand to other states as well.
Oh, that's beautiful. I love that model. And as we're approaching more of this cohesive, almost like a membership style practice where patients really have to understand this is slow cook medicine. This is not fast food. This is like it's a journey and it's an investment and it's a dedication to your own health. And whether it's insurance or cash based, it's the same kind of intention of you're in this to learn about your body and what little pieces you can do to affect and impact your health and how you can utilize both modern medicine and holistic medicine and integrative medicine. So, as you're looking at this, oftentimes patients can feel overwhelmed. I mean, it's a lot to take in.
Yes.
And so, that's like the other end of the scale where I work with practitioners. We get excited and passionate about what we do, and we tend to overwhelm our patients because we have this laundry list of things that we're excited for them to tackle. And they've got life happening over here. So what would you say is a typical time frame for a patient if they're seeing you and then they see your colleague, your lifestyle? Like what would you say, is this like a monthly thing? Are they looking at a 6-month kind of commitment where they see different
Right.
people?
Right. That's a great question. So, the frequency of visits varies depending on the type of patient that comes in. If the patient needs more work, they'll be seeing the rheumatologist at least once a month. And then they might be seeing lifestyle medicine every 2 weeks to 4 weeks in the beginning. And then we might, depending on if the patient actually needs to see a dietitian, a psychologist, lifestyle medicine might back off a little bit so the visits don't get too overwhelming. But the response we've had from patients, sometimes they say they love seeing everyone. And it could be well, we say give it 6 months. Sorry. We tell patients to give it 6 months time to see whether um, they to get results. But we've seen patients get results within 30 days.
That's
Um,
amazing.
'Cause some patients they just need anti-inflammatory diet. That's all they need, and our
Right.
protocol works for patients. We have patients who went to remission within 2 months. Patients that have arthritis with erosions, holes in the bones, that didn't
Oh.
want to take meds, we were told to go on biologics. We worked on them. They went to remission within 2 months,
And I
and they found
love
their
this because you're able to kind of try all the keys in the lock. You're able to get that time of saying, okay, let's try food. Okay, maybe not. Let's try, looking at your gut or food sensitivities or trauma, or like you're able to kind of access this along different portals and figure out what is going to unlock that for them. And I think that is also the unfair expectation that a lot of patients have on any practitioner that, well, they didn't help me. I guess I'm a lost cause because that one doctor, even in the world of functional medicine, and not everybody can know everything. So maybe your forte is HPA axis or, gut health, and then you're missing something else like mold or mycotoxin. So there's,
exactly.
yeah, so there's like so many times that even the most well-meaning integrative or functional practitioner just may not have the knowledge or tools. It doesn't mean that you're broken or that you can't get better, but having somebody systematically kind of go through is a really great advantage. Um,
Exactly.
yeah. Yeah,
Yeah, I
and
was gonna add, at Remission, we don't treat mold or Lyme or tick-borne infections, but at least we're aware of it. When patients talk
mhm.
to me about it, I don't deny it. I actually am able to lead them to the right place. And in my own private practice, I treat mycotoxin illness, Lyme and co-infections, all that stuff.
Mhm.
But under insurance model with
Mhm.
seeing these patients from a traditional and like alternative perspective, I think we're a good balance. Because when you
Yes.
talk about mycotoxins, Lyme and co-infections, sometimes the traditional healthcare system might look at you very weird, especially when we're taking insurance. There are patients that are seeing the academic centers. So
Yes.
we're a good balance of, hey, we know that medication is the only answer, but we can use food as medicine. We can use all these other tools in the toolkit to help you and not be too down the road of interfunctional medicine where it sort of bridges
Yes.
naturopathic medicine.
Yes, I'm so glad you mentioned that because all too often, I think patients and practitioners alike feel this almost rigid black or white thinking that if you have mold or mycotoxin, you have to do everything on there to cure yourself. And like you spoke of this earlier, you kind of hinted at it, the retraining of your brain and how impactful that can be, even outside of an insurance model or inside the insurance model. If you start looking at how we can use DNRS or Gupta or
Exactly.
some of these programs, my favorite's Primal Trust. All these programs do the same thing. They help you really disengage that accelerator of your brain on the inflammation of your body so you can get a lot of healing without going through the laundry list of things in a typical mold mycotoxin plan. So I love that you're bridging that gap. You're allowing, because let's be honest, our insurance does not even like to even hear the word mold or mycotoxin or Lyme. It's, under insurance care, they kind of think it doesn't even exist. So
Right. Right.
yeah.
I mean, that diagnosis, mycotoxin element, does not exist in our ICD-10 codes. It's mold exposure, but
Yeah.
that's it. So it's very challenging to do if you go functional medicine all the way.
Right, right. And but I love how you're bridging the gap. And again, this is not a fatalistic view. If you're a patient listening, like, oh no, I'm never going to get better. Not at all. There's so many different tools out there and not one way to heal or one path. Similarly, practitioners out there, you're going to see this, and we already have seen this. Practitioners are creating their own unique work-life masterpiece. They're delivering medicine in the way they want, just like Dr. Micah. I mean, you're creating this empire of Remission, which I love. The inner wannabe graphic artist in me is just like drooling over your logo and your
Oh,
title of Rheumission. Oh my gosh. Um,
oh, thank you. I have to give it up to our team, Katie Clary, our VP of marketing, create that logo and did all the artwork behind the website. So she's amazing.
And yeah, if you're listening and you're watching on YouTube, I mean, really go to his website and check it out. I'll put it in the show notes. It's Rheumission, spelled like room, like rheumatology, Rheumission. But just go to the website and just look at the beautiful logo. And it's so simple and it's a bullseye, right? Because that's the mission, right? You're trying to, kind of tackle this rheumatologic soup of autoimmunity here. And you're doing it in such a unique and innovative way. A couple other questions as we're concluding. One of my favorite ways to inspire practitioners is really letting them tap into that inner power of creative flow, because that's where our brain produces all five neurochemicals of happiness. That's where we glow as practitioners. We aren't anymore a robot in the machine of healthcare. We actually are self-expressive and able to show the world our passion. So when you were 8 years old, what did you do for some creative fun?
Oh my God. I think I just play video games.
That's awesome. That's very flowy. That's very flowy. Did you ever dream of designing video games?
No, I thought maybe I'll play video games for a career when I was 8 years old.
I think
Thank God I
every
don't.
eight-year-old does. Yes.
Yeah, thank God I don't. I had friends who I think during college would play test video games as a
Yeah.
job. And that's nowadays when I look back, I'm like that sounds very soul sucking because you're playing the same video game over and over again.
Yeah.
Uh,
Yeah,
but yeah,
trying to find the cheat codes and all the things. Oh my
yeah.
gosh. Yeah,
When
but I
when
think
you're older, that doesn't sound as attractive. Maybe for some people it does.
right, I think every 8-year-old though always dreams, like at least now in my kids' generation. I never knew this was a career choice, but many of them put on there, I want to be a YouTuber. And I'm like, how is that even a thing? But it is. So, you know what? I
Yeah,
don't think you're alone.
yeah, and well, actually, you know what? I remember one actually something that's actually artsy is I play piano. So at 8 years old, I was playing piano.
Oh, that's beautiful. That's awesome. And what do you
Yeah.
do now to fuel your little play area of your brain? What do you do for
Oh,
fun?
I'm trying to get back into piano.
Nice.
I don't know what do I do for fun these days. I mean, I work out. I do YouTube. I'm on social media just like you, Lara.
Yes.
So I'm
Yes.
trying to get that going too. So there's a lot of things I'm learning all the time. I think one thing that keeps me going with in medicine is the fact that there's so much to learn, especially in the integrative functional medicine world, and it's
Yeah.
never boring and it's so challenging because you're essentially teaching yourself. You have no more
Yes.
attendings to teach you. You have these
Yes.
gurus and these different niches like mycotoxin
Yes.
illness, Lyme that you have to learn off of, but you have to incorporate yourself and how to practice it yourself. So
Yes.
that's what keeps me going. Because I keep
Yes.
learning this, going down different rabbit holes.
Yes. Oh my gosh, you just are singing my song. I mean, that is the double-edged sword of a life in functional and integrative medicine is you're endlessly fascinated because it's a rabbit hole of just this gluttony of knowledge that you can just start to learn these nuggets. But really, when the rubber hits the road, can you apply it in your own clinic, in your practice? And that's really the mark of an excellent clinician is one that can discern, okay, this one's just for fun. I'm learning about all these geeky things. It's not going to really make a difference in the way I practice, but I'm going to use elements of that over here and I'm
Mhm.
going to impact patient lives. So very grateful for your work because you have been changing lives and I'm just excited to see you soar. And I hope this is a verbal promise that if you do start a podcast, I want to be a guest on it because I love your work.
Oh, yeah, I would love to have you be on the podcast.
That's
Yeah.
awesome. Awesome. Well, in the last 5 minutes, do you have anything else you want to share with our listeners?
Yeah, so if you're a patient, definitely check out Remission. We take insurance there. We do integrative medicine. There's a whole team behind this that can see you, and you may not need to go down the rabbit hole of functional medicine. You might not need to explore Lyme and mold. That's not for everyone. Some people they just need to change their diet, work on stress, and they get better and they can get off medications. Of course, is that gonna fix everyone? No, but for a lot of people, it's a great start and it can fix them. Other people, they might need to go a deep dive on functional medicine, and that's where my private practice comes in. I test for mycotoxin illness. I do Lyme and co-infections. I do alternative therapies there that people they need to go down that rabbit hole. So that's my other practice at Doctor Lifestyle. I mean, you could just look my name up online. You can find me anywhere. But there are a lot of people suffering from autoimmune disease these days. The number is only going up, especially in rheumatology. And right now, the rheumatology landscape, what is it? Just more biologics, more medications that
Yeah.
come up.
Yeah.
There's data for the vagus nerve, and there's data
Yeah.
for RA, lupus, but no one's incorporated that at all. I don't know
Yes.
if they're ever going to incorporate it. Maybe 10 years down the road, we use that already at Remission. We use vagus nerve
Yeah.
stimulators.
Oh,
Uh,
nice.
So, I mean, there's no money to be had in rheumatology and for pharma. So I don't know if it'll ever be implemented in the guidelines. But
Right.
there is evidence, I mean, helps with anxiety, depression. They're FDA approved
Yes.
already,
I
right?
love vagal stimulators. I have like
Yeah.
2 or 3 different ones in my clinic. Yeah.
Oh, yeah, I have 2 of them too at home. So, being an autoimmune patient, I understand what's it like to be have autoimmune disease, especially rheumatic disease, especially at a very young age as well. And I would tell you doing all this education, going down these rabbit holes, nonstop learning, that there's no one size fits all. As with diet, there's no one size fits all, as I mentioned earlier. But I mean, there is a theme with a plant predominant diet or a lot of phytonutrients that can be helpful. Also, there's some people they have infections that are causing their disease. Maybe it's mental health. You don't know what your true potential of healing is if you don't keep exploring.
Oh, right there. You don't know what your true potential of healing is until you keep exploring. I love that. I love
Yeah,
that. Thank you so much, Dr. Yu, for being on our podcast. I'll
of
put all
course.
your links in the show notes. If you're a patient, go check out Remission. And I'll put also my autoimmune MD on there and your social media. I mean, we need to take care of our bones, our joints, our muscles, and our livelihood. And that includes mind body medicine as well. And you've nailed it all. So thank you again, Dr. Micah, for being here. And
Of course,
every
I can tell you. Thank you so
Yes.
much.
Oh my gosh. And everybody listening in, continue practicing that sixth vital sign of creativity and coloring outside the lines every day to activate that creative flow and become your highest self expression of creativity. Until next time, have a wonderful day.